all, this video is part of the support package for fitness instructors who are becoming Smash It instructors. My name is Aneri, and in this video we will share the implications of exercise in relation to intellectual disabilities, which is the preferred term, therefore the most respectful choice of language. 2 to 3% of the population has an intellectual disability, and each person with an intellectual disability is unique and individual. At the same time, there are some commonalities which can have implications for their exercise response. Participants with intellectual disability will have an IQ under 70 and significant limitations in conceptual skills like language and literacy, concepts of times and numbers, and self-directions. Social skills related to self-esteem and the ability to follow rules or complex instruction, and practical skills involving activities of daily living, travel, schedules and routines, safety, use of devices, and occupational skills. Social skills can include interpersonal skills, self-esteem, and ability to communicate clearly. Severity of intellectual disability is largely based on IQ, and most people with intellectual disability have mild disability. Some may have experienced secondary complications for which they may be taking medication for, like seizures, cardiac defects, neuromotor dysfunction, or physical malformations. Medication which can lead to side effects, most of which can benefit from exercise, like pain, osteoporosis, overweight and obesity, and behavioral issues. Less than 10% of people with intellectual disability reach minimal physical activity guidelines, leaving them at a greater risk of chronic disease.
Bearing in mind that every person is unique, some considerations for anyone with intellectual disability include a likelihood of lower maximal heart rate, cardiac output, and peak aerobic capacity, typically responding well to feedback, often not being able to read or reading at approximately third grade level, frequently have impaired executive functioning like memory, flexible thinking, planning, time management and organization, and reduced processing speed, often exhibiting reduced stamina and fatigue more easily. Some additional points to bear in mind when including participants with Down syndrome are potential congenital heart disease, present at birth, in which regular moderate intensity exercise is recommended. Increased likelihood of atlantoaxial instability, in which excessive flexion and extension of the neck are to be avoided. Potential excessive range of motion due to low muscle tone and flexible ligaments. In this case, building both concentric and eccentric strength in the muscles around affected joints and working through as full of a range of motion as possible is ideal, limiting sustained stretching where possible. Participants with fetal alcohol spectrum disorders may have additional difficulty with balance, motor coordination, and skills requiring eye-hand coordination. Consistency and using lots of repetition and cueing in different forms are beneficial, and incorporating exercises that improve balance, motor coordination, and hand-eye coordination skills are recommended for participants with fetal alcohol syndrome.
As we said, each person is individual and how they experience their disability can be unique. For this reason, consultation is ideal. However, for group programs, screening forms are standard practice to gather health history. These can be completed by the participant, guardian, or support person. Check out our Inclusive Times video, which provides many more tips and guidelines on how best to include participants with intellectual disabilities.